Breast cancer is the commonest cancer prevalent amongst urban Indian women. And like all other cancers, it gets diagnosed at a very later stage usually. Today we have Dr. Shona Nag, Senior Oncologist at Sayadri Hospital, Pune, to understand the basics about breast cancer. Welcome, Dr. Nag.
Thank you.
Thanks for joining us today. Doctor, breast cancer is a dreading term to hear and even to relate to. But what happens is most of us are not equipped with the basic knowledge.
Well, the first thing I'd like to tell people who are watching this program is that breast cancer is completely curable when it's detected early. Breast cancer starts off with nothing but a small lump in the breast, and this is either found usually by the woman herself or during a gynec checkup when she goes to the gynecologists. Now, when 95% of all breast lumps are not malignant, and that's something everybody needs to remember, and there's no reason to panic or to get alarmed when you find a lump in the breast. But the minute you do find a lump, it doesn't make sense to wait at home. You need to go and see the doctor immediately. Who are the best people to see? Your family physician or your gynecologist. And depending on what they feel when they examine you, they will advise further testing. Like I said, most breast lumps are benign, but a small percentage of them are cancerous. Now, the risk of breast cancer comes when women are getting married late, women are having their first child after 30, women don't have any children, women don't breastfeed. So, they're all hormonal factors for breast cancer. So, it is the urban cities in India like Mumbai, Delhi, Chennai, Pune, Ahmedabad, Bangalore. These are the cities where breast cancer is becoming more and more common, and we are blaming it on the westernization of the Indian woman. So it is a good idea for women living in the cities of India to come regularly for a checkup.
Exactly. So as you said, what are the major predisposing factors or risk factors?
So the risk factors, like I said, are all the factors related to late marriage, late period, early period onset and late period finishing. So the duration of periods is long in a woman, or lack of breastfeeding, or a high fat diet, obesity, alcohol consumption. So habits which are usually associated with a fast lifestyle. And which is happening in the cities of India. So these are the risk factors. And the minute a woman finds something wrong, so we advocate self-examination of the breast for women, and we actually go around teaching this procedure. It's simple, it takes 5 minutes, it's to be done once a month after a bath, and it can pick up smaller abnormalities. And these are the risk factors. Again, a faulty diet, stress, which occurs in women who work all the time, don't pay attention to regular habits. So that's becoming more and more of a problem in our country.
Does heredity have a role to play?
Well, in less than 5 or 10% cases, heredity has a role to play. It is familial. You will find breast or ovarian cancer in the first degree relatives, for example, mother, grandmother, aunt, cousins, older sisters, younger sisters. So this is the kind of family pattern we look for. But when we're saying only 5 or 10% are familial, the other 90% is in our hands. And that's something certainly that we can prevent in this country.
So what are the alarming signs and symptoms, or how a woman would realize
that she has a... So when she feels a breast lump, in particular when it's painless, in particular when it doesn't move within the breast. So these are a few signs that should alarm her immediately. Or if the skin on top of the breast is wrinkled, or for suddenly some reason or the other the nipple gets taken in, retracted, or if there's a blood-stained discharge coming from the nipple. So these are the signs and symptoms of breast cancer. Even breast lumps under the armpit are dangerous, and usually they are due to infection. We work in the kitchen, we get cuts on our hands, we get painful lumps under the arms. So that is not a problem. But when these lumps are fixed, they are hard, that should bring the woman to the doctor immediately.
So basically you are trying to tell us that any kind of lump should not be ignored in the first place?
No.
That is another story if it is a cancerous one or not.
Yes, but at the same time, see, we got to balance. Life is all about balance. So when you have a lump, there's no need to panic. And I have a lot of young girls coming to me. They read things in the papers. Angelina Jolie was in the paper for all, I don't know whether it's the right or wrong reasons. But rather than create awareness, I find women get panicked very fast. And I had a whole lot of young women coming in with apparently normal breasts, or some of them with absolute harmless lumps. It's good that they came in because I could teach them self-breast exam. So I use these opportunities to spread awareness and teach about self-breast exam. So it's important to be vigilant, at the same time not be over cautious.
Okay. So there's nothing to panic
No.
on seeing just.
We are still much better off than the West. In the West, 1 in 8 women will get breast cancer during their lifetime. Here it is 1 in 30, 35 women in the cities, and 1 in 60, 70 women in the villages. And it's so funny, a village will be right next to a city, okay? And yet the risk of breast cancer is so vastly different. So we're trying to study what is it in the villages that we can adopt in our... Maybe the lifestyle, maybe the lack of stress, maybe a diet which is healthy, which is really grassroots, less preserved foods, and fresh food, and fresh vegetables, and no junk culture. Yeah.
So what do you suggest for the various screening or diagnostic methods that one has to go for?
See, women are, I won't say that cancer is a good thing, but I will say that women have the advantage over men. Breast and cervical cancer are the most common in women in India. And they are also the most superficial and therefore easy to detect. So they are easily diagnosed, and it's a crime if women don't come forward for screening in the general population. Screening means testing a woman that is not symptomatic, a normal person like you or me. So basically we recommend a self-breast exam and a clinical breast exam in women over 20-21 of age to be done once a year. We also recommend a pap smear once the woman is sexually active or married after 21 to be done every 3 years till the age of 65. After the age of 40, we recommend a screening mammogram to be done. And then a mammogram should be done once a year from 50 onwards, because as age increases, breast cancer incidence also increases. So these are the basic tests that need to be done.
So basically you are saying that prevention is the key.
It is the key, because when we pick up tumors that are not found clinically, in the sense on a mammogram, cannot be felt, but a spot is seen that turns out to be malignant, or cervical cancer is found in the real initial stages by a pap smear, 100% curable. It's as if it never happened after the treatment is over. For cervical cancer, if it is found right in the early stages, you don't even need a surgery. A biopsy can cure the disease.
Early detection leads to a better prognosis.
And less surgery, less treatment, no need of chemotherapy, and ultimately cure.
Thanks, Dr. Nag.
Not at all.
Very grateful to you for
Not at all.
Breast cancer is indeed curable. All it takes is early detection, right treatment, and most importantly, courage to fight it. We must understand that the key here is prevention. Regular screening tests will keep you abreast with your breast.